Hello folks, let me teach you today an important NCLEX concept which is related to pediatrics. We're going to discuss today about Wilm's tumor, which is also a pediatric kidney tumor. Now there are questions which comes in your examination. You should be able to approach it in a smart way. Many a times students do feel that memorizing a particular topic would give you the highest points. No, understanding the concepts would. So let me pop up a question so you can understand what type of questions do come in your examination and how to approach those questions. So question on your screen now. Now you can see a nurse is caring for a child diagnosed with nephroblastoma. Which assessment finding is most important for the nurse to monitor closely to prevent complications associated with conditions? You can see four options. First option, liver function test. Second option, capillary blood glucose levels. Third one, blood pressure. And D option says visual acuity. Now when you look at this question, always remember one point, one clear point in your mind. If you ever see a question on kidney tumor, what can be the most common complications? If you understand a common complication, if you know that very well, answering these type of questions won't be that difficult. Let me go ahead and explain you in short what exactly happens in this and what are the complications that you can expect. Now again, let's get back to the screen. Nephroblastoma, what is it? It is a malignant kidney tumor commonly seen in children. One of the major complications of this condition is hypertension. Now, why hypertension? So, the question that comes in our mind is why hypertension? The reason being, as you may be aware, kidney is responsible for renin-angiotensin mechanism. So, this tumor can compress blood vessels, and if the blood vessels are compressed, that can cause high levels of pressure. Also, this will activate something called as RAS, R-A-A-S. What is RAS? RAS stands for renin-angiotensin aldosterone system. That results in elevated blood pressure. And if this hypertension is not treated immediately, or if you don't take that into consideration immediately, that can lead to stroke, heart failure, or renal damage. So now if you look at this question, now you know this question is about nephroblastoma. You know the finding that you can see in this question. You can see there are four options, like which is the most important for the nurse to monitor. If you read between the lines, you need to understand over here the question is about most important. First option says liver function test. Second option says capillary blood glucose levels. Third one says blood pressure. D says visual acuity. Now, if you look at this question carefully, liver function test doesn't apply directly. Capillary blood glucose level doesn't have any connections with renal tumor. Visual acuity doesn't make any sense. So, the closest option over here, the most important, because since the tumor is on the kidney, kidney can compress the blood vessels that can also activate renin-angiotensin mechanisms, and that can activate the system which will automatically lead to increased blood pressure. So the answer over here is blood pressure. I believe this was useful, and these kind of concepts, if you clear these concepts in your mind, understand the concepts rather focusing on memorization, clearing this examination or passing this examination would be a cakewalk for you. Want to learn more like this? Join us right now. This will help you.